Hey, my patient I was in the Ortho Trauma unit. I had a 75-year-old male who was admitted for a fall. He fell from ground level, mountainside, um, and had a fracture of his left hip. So his pain was constant, left leg, left hip, knee, and also he had chronic back pain as well from a previous injury. Like I said, the pain was constant, sharp, and any kind of movement would aggravate it. Ice packs did help alleviate it a little bit. Treatment, he was on morphine, had been on it for over 20 years, and his pain level during assessment was a 7 out of 10. So he is on enoxaparin, morphine, lactulose, vitamin D3, and Flomax. So his previous health history, he's had both knees replaced. He does have liver cirrhosis, and then chronic back pain, and a previous back surgery. His current injury with the hip and like where the hip and the joint meet, he had a nailing of the femur to kind of put that back into place. So his vitals were good, 98.9, temperature, heart rate was 84, blood pressure was 127/61, respiratory rate was 16, oxygen saturation was 95% on room air, and then his glucose was 95, so that was all really good. During assessment, he was alert and oriented, ×4, cardiac, his S1, S2 sounds were present, no abnormal sounds present. His lung sounds were clear with a bilateral chest rise. He had hypoactive bowel sounds. He hadn't had a bowel movement in 5 days, so we did encourage him to take his lactulose, which he did. He did urinate without any burning or pain. The Flomax has helped with this as well. He had no signs of lesions, ulcers, or wounds. His extremities were 5 out of 5 in all of his extremities except for those that lower left leg. And then he had, like I said, his pain was a 7 out of 10 on a 0 to 10 pain scale, mainly for the hip fracture, but also for his prior back injury. So he had a nailing of the femur. He also had an x-ray of his knee while we were in there. We were waiting on labs to give him his Lovenox. His platelet count was really low. It was actually in let me see, his platelets were 52,000, so extremely low. So we held his Lovenox and then gave it to him later in the afternoon after they had taken labs again. And then, let's see, so obviously his problem list for the day was pain associated with his hip and knee, encouraging the patient to have a bowel movement. So he did take that lactulose, which was good. And then, assisting with ADLs, things like that, having PT come in and work with him. So the nursing diagnosis that I have was a risk of bleed related to his prescribed Lovenox injections, constipation related to immobility, and hip fracture as referenced by no bowel movement for 5 days. So for the short-term planning, just the patient will notify us of any signs of bleeding. During our 8-hour shift, patient will also take laxative and try to make a bowel movement by the end of my 8-hour shift. And then just some of the interventions we did was to administer his lactulose as prescribed, encourage him to increase his fluid intake to help keep that moving. And then as far as the risk of bleed, just monitoring those platelets, his hemoglobin, and his hematocrit, and also examine skin daily to assess for any like external bleeding, monitor blood pressure and heart rate for any internal bleeds, for being on that enoxaparin. And then, so the short-term evaluation, the patient met the goal and did not have any bleeding or signs or symptoms of internal bleeding. I'm not exactly sure if the patient had a bowel movement because he was actually Dalton's patient, but so this could not be completely accurate because I wasn't able to go back in the room towards the end of the day, but I just put that he did not meet the goal of having a bowel movement, but he did take his laxative in the morning. And then obviously discharge planning, the patient needs PT before being discharged home. He also needs to be able to ambulation once his hip has healed to ensure that he can perform those daily ADLs at home by himself. And that is it. Thank you.